This is the first of 2 presentations about Autism Spectrum Disorder. In Part 1, we want to share some information about what ASD looks like in children, signs to watch for, and how doctors and schools can help with identifying and diagnosing autism. We'll also share some resources at the end of this session that you can use if you'd like to learn more. Our mission at Arkansas Support Network is to recognize and support every person's right to be included in the life of the community. As soon as a child or adolescent is diagnosed with a disability, we need to start thinking about how to support them and provide them with the resources and services to learn and develop the life skills they need. That way we can help them to enjoy life and be active members of their community. The Centers for Disease Control and Prevention report that approximately 1 in 44 children has autism. It's estimated that 1 in 27 boys and 1 in 116 girls are diagnosed with autism in the United States. Though medical professionals haven't been able to determine for sure why so many more children are now being diagnosed, the American Academy of Pediatrics has stated that there may be several reasons for this increase. It could be due to families and schools being more informed about autism, and also that pediatricians are more aware of looking for the signs. In the last decade, there have been many changes in how autism is defined and diagnosed. The American Psychiatric Association, in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, describes 3 levels of autism spectrum disorder. Level 3 indicates that a child has severe autism and requires very substantial support. Level 2 indicates that a child has moderate autism and requires substantial support. Level 1 indicates that a child has mild autism and requires some support. The type and severity of symptoms vary widely among children with ASD. And autism often coexists with other conditions like attention deficit hyperactivity disorder, learning disabilities, intellectual disabilities, or mental health conditions. Asperger's syndrome is a term that has been used in the past to describe a milder level of autism. Doctors and scientists still don't know the cause of autism, but there are several theories. Research shows that genetics are involved in most cases, and there's some indication that a child born to older parents is at a higher risk of having autism. Studies are being done ongoing to try to understand the causes and improve interventions that address the symptoms of autism. Parents sometimes think that the symptoms begin because of a vaccine, a traumatic situation, or an illness. Over the past 2 decades, extensive research has been done to determine whether there is a link between childhood vaccines and autism. The results of the studies have proved that vaccines do not cause ASD. Schools don't diagnose, but they can help if a student shows signs of autism at school. Screening and assessment can be used to guide the school team in identifying autism and choosing the right services. The resulting reports and documentation can also help the student to access other services in the community, like Arkansas Medicaid's Community and Employment Supports, or CES waiver program, and Social Security benefits. School districts now have much more information and many more resources to rely on to learn how to help autistic children to be successful in school. If you're the parent or caregiver of a child with autism, you have the right to expect teachers and school staff to be informed about autism and to know or learn how to support your child. A medical diagnosis of autism is needed in order to get applied behavior analysis, or ABA therapy, and other programs and services. The family doctor or pediatrician may refer the child to a psychologist for an evaluation specifically to rule out or diagnose autism. According to understood.org, a diagnosis of autism is made based on several pieces of information: the parent's description of the child's development, specialist observations of certain behaviors that are symptoms of autism, medical tests, and the child's medical history. There are currently 2 clinics in Northwest Arkansas that can provide autism evaluations covered by Medicaid. A few other clinics provide this evaluation, but only accept patients with private insurance or those who can pay out of pocket. Every child who has a diagnosis of autism has different needs. The American Academy of Pediatrics recommends that all children be screened for autism during their well-child check at 18 and 24 months. The research shows that starting an intervention program as soon as possible can improve outcomes for many children. Difficulties with language development and communication are often an early sign of autism in children. Frequently, children with ASD have difficulty expressing themselves, for example, being part of a conversation or controlling the volume and tone of their voice. Instead of answering a question, a child with an ASD diagnosis may repeat the question or repeat something from the TV or a video game to respond instead of making their own sentences. It's common for people who are on the autism spectrum to have difficulty picking up on and responding to sensory information. They may seek out or avoid certain sensations or have more sensitivity to light, sound, and things they touch, the taste of certain foods, or smells. This can cause the senses to overload and can lead to a meltdown. Along with difficulties in communication and sensory processing, children who have been diagnosed with autism may also have a hard time coordinating their hands and arms, as well as larger muscle movements for running and jumping. Children with ASD may have limited interest and repeat movements or behaviors frequently, like rocking, lining up objects in rows, or spinning. Changes in daily schedules or moving from one activity to another may cause a great deal of stress and anxiety. Children with autism often have difficulty sleeping and learning to use the bathroom and may eat only certain foods that they prefer. We've talked about the statistics, symptoms, diagnosis, and challenges that children who are diagnosed with autism often face. In part 2 of this presentation, we're going to talk about some interventions and supports that can help children with ASD learn to use their strengths to create a good life with hope and possibility. Every person who has an ASD diagnosis is different, just like everybody else. The right therapies, help, and supports can assist people with ASD to leverage their strengths in education, the workplace, and the community. The ability to be detail-oriented, a characteristic that's useful, for example, in jobs that require a high level of attention to detail and rules, can be very valuable on the job. Companies that place a priority on innovation and creativity benefit from having employees who can think outside the box. Temple Grandin is an autistic person and a scientist who has changed many practices in the livestock industry and supported humane treatment of the animals. Dr. Grandin invented special equipment to help coordinate the movements of livestock and keep them calm. This equipment is now part of the industry standard. She's written several books to help people understand more about autism based on her own life and experiences. Dr. Grandin teaches that autistic people think and learn differently from neurotypical people, and she encourages us to nurture and support those differences. Interventions for autism are used to reduce symptoms and help children grow, learn, and participate in their home life and in the community. In many cases, given appropriate support, respect, and therapy, people with ASD can lead independent lives or are able to function almost completely independently with some support. Although the autism may seem very mild or like it has gone away, children may continue to need help as they grow to adulthood and go through the changes and life challenges that human beings face throughout our lifespan. The condition of autism does not disappear with time, but it may be that the person can learn skills and coping strategies necessary to function well and have the life they want to have. Most of us need the support, counsel, and understanding of people in our lives as we work to make difficult decisions about how to manage our own lives. Receiving the right therapies and services can give children with ASD the skills they need to form healthy relationships, communicate feelings and opinions, learn to make decisions, and work to solve their own problems. This work can give them the opportunity to create their own adult life and participate in the community. In our next presentation, we're going to talk about Applied Behavior Analysis Therapy, or ABA, an evidence-based intervention for autism, along with some other therapies and interventions. We'll also share information about some things families can do to help children with autism at home, as well as how schools work to support students with autism so that they can have equitable access to the academic program and social relationships at school. You'll find the link to Part 2 of this presentation in the description of this video. At Arkansas Support Network, the Division for Children and Families offers information about applied behavioral analysis therapy for children and youth with autism up to age 21, and services for children and youth with disabilities up to 18 years of age that are in the custody of the Department of Human Services. Our Family Support Program serves families with children who have disabilities, as well as youth and adults with disabilities, and our services are free of charge. We provide information and training about special education services, health services, and educational and community resources. These are some online resources that can be helpful if you would like to learn more about autism spectrum disorder. Thank you so much for your time. We hope the information in this presentation has been helpful to you, and please let us know if we can be of assistance.